Nephro-Urolithiasis and urolithiasis is the most common presentation, not only in the general surgical part, but in urology as well. Technically, nephrolithiasis means that any stone which is present in the kidneys, okay, like maybe in the renal parenchyma or maybe just above the ureters. Now, urolithiasis is technically the word which is being used for the stones which are present anywhere in the urinary tract, starting from the renal pelvis down to ureters and then maybe in the bladder. But most commonly, the acute presentation is the ureteric stones, which we usually label the disease as the ureteric calculi, or the patient actually present with acute ureteric pain. So we actually classify this as renal colic or ureteric colic. So most common presentation is the ureteric colic. This is important topic, so we will be discussing it in today's lecture. Plus, before going into the detail of the renal stones, their formation, their clinical presentation, and how you're going to make a diagnosis, again, we'll go back to the basic surgical anatomy of the kidneys. So if you could appreciate here in this diagram, this is the important the structure which is called as a kidney, and every normal human being actually have two kidneys, right and the left, which are surrounded. It's actually the renal parenchyma, and then there is a proper renal capsule which are surrounded by the perinephric and paranephric fat as well. So if you could appreciate here, this is actually the renal cortex, okay? And these are the renal pyramids. And if you could see these renal pyramids, they are entering into the calyces, okay? And this is the renal pelvis, which is going down all the way. And this is the pelvic ureteric junction in which the renal pelvis is entering into the ureter, and right and the left ureter are, they're just getting their exit from the renal pelvis. Now, if you could see here in this diagram that we got the renal cortex, and the other part is the inner part is the renal medulla. So this is actually the pyramidal shape part, which is called as the renal pyramid, and this is the base of the pyramid, and you can see the apex projecting down into the renal columns, and they're the calyces. These, if you could see here, these are actually the calyces, and these calyces are entering into the renal pelvis, which is getting entry into the ureter. And then these parts just in between the renal pyramids, they are called as the renal columns. So main part is the renal cortex, and the other part is the renal medulla. Now, if you could see, I'm now going to go back into the physiology and how the kidneys work and what is the glomerular filtration rate. That's a complete whole different thing to know. But most of the time, the concentration and the dilution, the mechanism of the concentrating and diluting segments, if you could go back into the details and microanatomy. So you have the glomeruli, and then these glomeruli are responsible for the filtration, ultrafiltration. And then it goes down, and there then is the loop of the Henle. Okay, so we have the ascending loop of the Henle, then you have the descending loop of the Henle, and so different parts of these glomerular filtration unit, they're responsible for reabsorption of the sodium, and they're responsible for the excretion of the water, and that's a whole different lot to study in a physiology part. So right now, we will not go into the detail of the physiology. Right now, you should know that we have actually the two kidneys, which are that's a renal parenchyma, which is made of the cortex and the medulla, and they're surrounded by renal capsule, which is surrounded by the perinephric fat. Okay, and just on the top of the kidneys, right here, if you could see the upper part, or you can see the upper pole of the kidney. So this is the upper pole of the kidney, and this is the lower pole of the kidney. And this upper pole of the kidney is, there are the adrenal glands, which are responsible for the generation of different hormones like glucocorticoids, and we have the other medullary enzymes as well. So the most important part to know here is the blood supply of the kidneys that's coming from the abdominal aorta. We have the right renal artery, and we have the left renal artery as well, and they're coming from directly from the abdominal aorta. Now, if you could see the renal pelvis, okay, so or you can say that's the hilum of the kidney. So there are important structures which are getting entry into the kidney through this renal hilum, and if you could see from above downward, it's a renal vein, and then it's a renal artery. So the renal vein, right renal vein, is shorter as compared to the left renal vein, because left renal vein is getting blood from the adrenal veins, left adrenal veins and the left gonadal veins. So the left adrenal and the gonadal veins, they drain into the left renal vein. That's the reason left renal vein is bigger and much longer as compared to the right renal vein, whereas the right adrenal and the gonadal, they directly get into the inferior vena cava. That's the reason the right renal vein is shorter as compared to the left renal vein. And there are lymphatics as well, and then you have the renal artery, which is actually supplying. Kidney is the most important organ, especially when the patient is in shock, or there's one of the most important vital organ, and you have to monitor the urine output when the patient is in the shock and when the output is, at least you have to maintain the output in 100 ml per hour, and when output is there, so that means the patient is out of the septic shock, or he is not in a septic shock at all if the urine output is adequate. So this whole of the but when the blood supply is compromised, when the volume is down, there's a lot of the bleeding. Also, there would be hypoperfusion, and hypoperfusion will lead to the renal parenchymal changes and will damage the glomerular filtration rate. Now, you talking about the Nephro-Urolithiasis, there are some important surgical anatomical structures we will be discussing in a couple of minutes, and you should know actually the etiology behind the development of these stones and what important structures you should keep in mind when you are dealing with the nephro or urolithiasis.